Okay, so hello, I'm going to show you now how to do the NG tube insertion for OSCE exam. This is a new station that's recently been added. So as with all the other stations, before you approach the patient, decontaminate your hands. Palm to palm with fingers interlace, back of the hands, fingernails, thumbs, centre of the palm and wrists. Checking my environment is safe to approach. And going up and introducing yourself to the patient. You don't need to ID the patient. For this, the examiner will tell you you've already ID'd them. So hello, my name's Beth. I'm the nurse looking after you today.
Hello.
Hi, so I've come here to put an NG tube in. What that is a tube that goes down your nose into your stomach. Is that okay?
Oh, yeah, okay.
Okay. So if you have any problems, it might be a bit uncomfortable whilst I'm putting it in. If you just raise up your hand and I'll stop.
Okay.
Okay, do you understand that?
Yes.
Okay, so what I'll do now is I'll get my things and I'll be back in a minute. Do you need anything?
Yeah, that's fine. I'll
Okay.
wait for you.
So I haven't touched my patient, so no need for me to gel my hands again. And now I'm going to prepare my items. So I've got my trolley here. This is not a sterile procedure, so I don't need to clean it. So the examiner will tell you it's already been cleaned with soap and water. So I can say, examiner, has this been cleaned with soap and water? And they will say yes. So to get my items for my procedure, I now need an NG tube, which as normal I'm checking it's clean, intact, expires 2025. I'm also going to get my 60ml syringe, which in the UK we're using these pink syringes for internal feeding. Clean, intact, expires 2025. My pH strips, again, clean, intact, expires 2023. Some tape, this is clean, intact. If it's in the box, I would check the box for expiry. I need a sick bowl or some kind of container. You could use a kidney dish if that's what they have in the exam. Might need some tissues. A cup with some warm water. And my gloves and apron. Before I put my gloves on, because I've touched those items, I'm just going to gel my hands again using the 7 steps. Okay, so going back to my patient's bedside, obviously I would provide privacy. I would draw the curtains or shut any windows. Now, are you comfortable like this?
Yeah,
Yep.
okay.
Yeah, so make sure your patient's in a comfortable position. This is part of the marking criteria, so I can see they're sat semi-upright here, so that's okay. Now I'm going to take the measurement for the tube. So opening my tube. So you can see here there's some markings on the tube to indicate the length. So using this, I'm going to measure how much I would need. So starting from the patient's nose, we measure to the earlobe. And then from the earlobe, we measure to the end of the zippy sternum, which is the end of sort of the rib cage. The end of the sternum, and I can see for this patient I've got 50 centimetres. Obviously it's a bit difficult for me to measure this one. It will be easier in your patients on the ward, but for the case of the exam I'm showing you how to do it with this one. Okay, so now I've measured the length of the tube. I'm keeping a note of that, so for this patient it's 50 centimetres. Now I'm going to check the nostrils if there's any visible obstructions. I need to ask the patient to press down on one side and sniff, and then again on the other side and sniff to see if there's any obstructions there. Obviously with this patient there isn't any, so I'm happy to proceed. Now I'm going to lubricate the end of the tube with 15 to 20 centimetres of water using my markings here. On the ward we do use the lubricant, but for the exam they want you to use water. Apparently it damages the mannequins. Okay then, alright then Titus, so I've got my bowl here in case there's any aspirate. Are you ready for me to put this in?
Yeah.
Yeah, so be just a bit uncomfortable, but just try and swallow for me.
Okay.
If you have any, if you want me to stop, just lift up your hand.
Okay.
Okay, ready?
Yeah.
So just insert it firmly, obviously, as quick as you can, up to the length you measured. So for this patient, I measured 50 centimetres. So I'm just going up to there. It is a bit more difficult to place on this one than an actual patient, unfortunately. Okay, you're doing really well. I'm almost done. Okay, so now I've reached the 50 centimetres mark there. Okay, so 50 centimetres should be at the end of my patient's nostril. Okay, obviously when I was inserting this, I would be watching my patients for any signs of breathless or coughing, and I would stop. So now I'm going to attach it with the tape. So we have these dressings to tape onto the patient's nose. You can also use tape depending on what's provided in your exam. Just to secure it nicely here for the patient. Okay, and then I would put another tape on the side of my patient's face to secure it there. Okay. Okay, so now I've inserted my NG and I've fastened it to my patient. I'm going to check the pH. So using my 60ml syringe, I'm just going to attach it to the end. That just screws on nice and easily to these ones. I'm just going to aspirate. And as you can see here, I've got some water coming out, some fluid. And I would just clamp off the end, leaving the guide wire in place. So now I'm going to check for my aspirate. So I just use a tissue here not to make a mess. So transferring your aspirate onto your pH strip. And then I'm just checking it against this bottle I have here to see what the reading is. So it needs to be less than 4.5, and I can see this one is 3, which indicates to me that it's acidic, so it's in my patient's stomach, so I'm able to use it. Before I use this, I would obviously use the hospital policy if it needs x-raying or anything like that, and then check again before I use it. So now I've finished with my procedure. I'm just going to check my patient's okay. So you all right there, Titus?
Yeah, I'm okay.
Okay, do you need me to do anything?
Oh, yeah, that's fine now.
Okay.
Yeah.
That's fine. I'll just let you have a rest then, and I'll be back a bit later on.
Yeah.
Give me a ring if you need anything.
Okay.
Okay, so now I'm going to dispose my items I haven't used in my yellow clinical waste bin, and I would document the procedure in the patient's medical notes, so I'm going to throw that away in the sink. Take my apron off first, and then my gloves, and then I'm going to decontaminate my hands, and that's it for your NG tube.